This is a case study for NUR 2102. Patient is Mrs. Zia Wang, presented by Yasmin Stephen, student number 1168113. So the patient presents a 94-year-old female. She's had a fractured left neck of femur repair, a hip replacement after a fall. Her medical history prior to admission was hypertension, rheumatoid arthritis, osteoporosis, and a previous stroke. The patient is currently in recovery, receiving oxygen at 6 liters via a Hudson mask with a target oxygen saturation of 94 to 98%. Her vital signs have been 20 breaths per minute, temperature at 35.5 degrees, just a little bit hypothermic, which is common after a surgery post-operatively. Can be managed with warm blankets or warm fluids. Her oxygen saturation is a 99%, which is actually above the target range, so could potentially be weaned from a Hudson mask onto nasal prongs if maintaining saturations. Blood pressure is 90/60, which is hypotensive, and heart rate is 96 beats per minute, slightly tachycardic. Considering the mucous membranes are also dry and the skin turgor is reduced, it can be assumed that this is probably due to dehydration. Sedation score is a 1 out of 3, so she is conversing with staff. So Miss Zia has quite a few risk factors, particularly age, because she is 94 years of age. And this can cause a lot of confusion, especially post-anesthesia, or high risk of falls, high risk of pressure injury, all those sorts of things. She also has the history of hypertension, which can contribute to her potentially getting blood clots, osteoporosis, which would contribute to lack of bone remodeling after the fracture. The recent anesthesia, as I said, having pain can cause delirium if unresolved. Malnourishment, dehydration, and polypharmacy. She takes multiple medications. So the nursing interventions, priority would be giving fluids and antibiotics as charted, monitoring her vital signs and neurovascular obs to ensure there's good perfusion to the affected limb, to monitor the surgical site for signs of infection or dehiscence, monitoring her Bellovac drain and how much it's draining, monitoring her pain, sedation score, and utilizing pain relief if appropriate as it's charted. Educate the patient and the family on reduced mobility status, that she's rest in bed until review from an orthopedic doctor. Referral to allied health further down the track for mobility and functional assessments, and then assisting patient with ADL as well in hospital, positioning her appropriately to prevent pressure injuries. So as far as the med chart goes, Miss Zia Wang, this is the PRN chart. So as required, she has fentanyl subcut 50 micrograms with a maximum of 250 micrograms in 24 hours, which will assist with keeping on top of her pain. And then a IM injection of metoclopramide. She can have 10 milligrams 8 hourly with a maximum in 24 hours of 30 milligrams. Also, haloperidol is there in case she does get a delirium post-operatively. She can have 0.5 milligrams BD orally with a maximum of 1 milligrams, all signed by the doctor, all valid orders. The gentamicin IV is an IV antibiotic, 40 milligrams. She doesn't currently have infection. The antibiotics are prophylactic to prevent infection. Additionally, Miss Zia has been prescribed an enoxaparin, which is a Clexane injection, a a anticoagulant, 40 milligrams once a day, which is for blood clot prophylaxis, subcutaneous route to be given at 8 o'clock in the morning. So a contraindication for this would be if she's having excessive bleeding, any like hematuria, if she has an IDC, any excessive bleeding from the surgical wound, we would flag with the team to see if they want us to withhold the Clexane. As well, for pain, she has oxycodone, naloxone 2.5, 1.25 twice a day. This is an oral slow release pain relief that will help control her pain throughout the day. She has paracetamol charted orally, 1 gram, 6 hourly, so 4 times a day. That will also assist with the pain. Could be potentially masking a fever if she does get some sort of infection. Taking Panadol regularly is also antipyretic, so that's something to keep in mind. Difenac gel, diclofenac gel, which she was taking at home, applying to hands twice daily for the pain, osteoarthritis. It's an anti-inflammatory topical medication. Also on atenolol, which is an oral tablet, 25 milligrams at 8 a.m. This helps with her hypotension that she had at home, but now that she's hypotensive, you would be withholding this medication, not be giving. And just to bear in mind, it's also for rate control, so it might drop her heart rate if heart rate is low. She's also on Rezidronate, which she took at home, an oral tablet, 35 milligrams just once a week, which is for osteoarthritis. Calcium carbonate, which is an oral tablet, 1.25 grams, 6 days a week, on the days where she's not having the Rezidronate. It's also for osteoarthritis or and flucloxacillin IV, which, as I said, is to prevent infection. It's a prophylactic antibiotic, a dose of 400 milligrams, 6 hourly, which is 4 times a day. All the orders are signed by the doctors and valid. Here is just the references that I've used in the slides. Thank you for watching my presentation.